Good morning. It's September 19th, and this is your daily brief in science. Here's everything you need to know. The mpox outbreak in Africa has escalated, with 14 countries currently affected. The Democratic Republic of the Congo, or DRC, is at the center of this crisis, reporting nearly 22,000 cases and over 700 deaths since the start of the year. In response, the World Health Organization declared mpox a public health emergency in August, leading to plans for vaccine purchases. Dr. Sania Nishtar, CEO of Gavi, emphasized the importance of effectively converting vaccines into vaccinations and establishing a global vaccine stockpile. Despite Kamatuga being identified as a priority for vaccine distribution, no vaccines have arrived yet, intensifying the urgent need for supplies in the region. Wealthy nations, including Japan, the United States, and Canada, have committed approximately 3.6 million doses of mpox vaccine to the DRC. However, only a limited number of these doses have been delivered so far. The DRC has received over 200,000 vaccine doses, with a rollout set to begin in October, focusing on high-risk individuals. Gavi plans to create a global stockpile of mpox vaccines starting in 2026, along with a vaccine production accelerator for Africa, supported by a budget of up to $1.2 billion over the next decade. Concerns are also growing among healthcare professionals regarding a new strain of mpox, particularly its potential impact on pregnant women who have seen high miscarriage rates. The outbreak's severity is exacerbated by a lack of funding, vaccines, and information, complicating efforts to manage its spread. In light of financial challenges exposed during the COVID-19 pandemic, Gavi has established a $500 million emergency fund to provide immediate resources for public health responses. Campaigners are pushing for faster vaccine delivery and lowered prices to ensure equitable access to treatment. Authorities estimate that around 3 million vaccine doses are required to effectively control the mpox outbreak in the DRC. Recent research has uncovered microplastics in human brain tissue, specifically within the olfactory bulb. This marks the first documentation of such findings, raising significant concerns about the health implications of microplastic exposure. The study, published in JAMA Network Open, analyzed olfactory bulb samples from 15 cadavers aged between 33 and 100 years, revealing microplastics in 8 of the samples. A total of 16 plastic fibers and particles were identified, measuring between 5.5 and 26.4 micrometers, with polypropylene being the most prevalent type detected. Researchers suggest that the olfactory pathway may serve as a significant entry point for microplastics into the brain, which raises alarms about indoor air pollution. The findings indicate that nasal tissue could capture plastic fragments, contributing to the presence of microplastics in the brain. Concerns have been raised about the potential for microplastics to alter cellular functions, particularly in vulnerable populations such as children. In related research, a study involving mice exposed to polystyrene microplastics under high-fat diet conditions showed significant changes in gut microbiota and glucose metabolism disorders. These findings underscore the health risks posed by microplastic exposure, especially for individuals consuming high-fat diets. Global scientists and campaigners are now calling for urgent action regarding the health impacts of plastics, advocating for a comprehensive UN Global Plastics Treaty. A final round of negotiations for this treaty is set to occur in November in South Korea, where stronger health provisions will be demanded. Maria Westerbos, founder of the Plastic Soup Foundation, has criticized policymakers for yielding to petrochemical companies and emphasizes the need for immediate action based on scientific findings. Overall, these studies highlight the pervasive nature of microplastics in the environment and their potential implications for human health. Recent research suggests that the diabetes medication metformin may play a role in reducing the risk of developing long COVID among its users. The study, led by Stephen Johnson at the University of Minnesota, analyzed data from nearly 76,000 Americans with type 2 diabetes. This research compared those who were on metformin to over 13,000 individuals who were not taking the medication. Data for this study was gathered from 2 major databases, N3C and PCORnet, which included 51,385 and 37,947 adults, respectively. Participants were all adults aged 21 and older who tested positive for SARS-CoV-2 between March 2020 and November 2022. Long COVID is characterized by persistent symptoms such as chronic fatigue, brain fog, and chest pain, affecting millions of Americans following initial COVID infections. Outcomes were assessed based on diagnoses of long COVID or death within 6 months after confirmed COVID-19 infection. Among the National Patient-Centered Clinical Research Network group, 2.2% of metformin users experienced post-acute sequelae of SARS-CoV-2, compared to 2.6% of those not using metformin. Additionally, metformin users showed a lower incidence of death related to post-acute sequelae compared to individuals on other diabetes medications. Despite a decline in new COVID-19 cases, millions continue to suffer from long COVID. The study was authorized by Stephen G. Johnson, Ph.D., and funded by the National Institutes of Health. The findings were published on September 17, 2024, in the journal Diabetes Care, based on health data from nearly 38 million U.S. patients. While metformin can be beneficial, it may have side effects and should only be used under a doctor's prescription. A recent report from the Lancet Neurology Journal reveals alarming trends in stroke cases and fatalities worldwide. The findings indicate that between 1990 and 2021, the incidence of new strokes surged by 70%, while stroke-related deaths rose by 44%. This alarming increase has positioned stroke as the third leading cause of death globally, with 1 in 4 individuals over the age of 25 projected to experience a stroke in their lifetime. The report highlights that more than 75% of stroke cases occur in low- and middle-income countries, pointing to significant disparities in healthcare access and outcomes. Researchers identified 23 modifiable risk factors that account for 84% of the global stroke burden, suggesting there are substantial opportunities for prevention. Lead author Professor Valerie L. Fagan emphasizes the urgent need for population-wide strategies to address these risks. Environmental factors are also critical in this context. The study notes that the impact of high temperatures on stroke-related health issues has increased by 72% since 1990. Additionally, particulate matter air pollution contributes to strokes similarly to smoking, accounting for 14% of deaths and disabilities from specific types of strokes. Experts are calling for immediate implementation of effective and accessible measures for stroke prevention, surveillance, care, and rehabilitation worldwide. Recommendations include establishing stroke surveillance programs and enhancing care and rehabilitation services for survivors. With approximately 12 million new stroke cases and over 7 million stroke-related deaths each year, the need for effective interventions is urgent. A new study from the Wellcome Sanger Institute has unveiled crucial insights into the RAD51C gene and its connection to breast and ovarian cancers. Published in the journal Cell, this research identifies over 3,000 harmful genetic alterations in RAD51C, significantly increasing the risk of ovarian cancer by 6-fold and aggressive breast cancer subtypes by 4-fold. Among the key findings are hypomorphic alleles, which reduce the function of RAD51C without completely disabling it. This discovery adds depth to our understanding of genetic risk factors associated with these cancers. Variants in the RAD51C gene hinder its ability to repair DNA, leading to a higher likelihood of cancer and severe genetic disorders such as Fanconi anemia. The researchers employed extensive health databases, including the UK Biobank, and a cohort of over 8,000 ovarian cancer patients, to validate the correlation between RAD51C variants and cancer diagnoses. These results are expected to enhance personalized medicine and cancer prevention strategies by refining risk prediction and therapeutic targeting. The implications of this research will aid diagnostic laboratories in detecting harmful changes in the RAD51C gene, ultimately improving cancer screening and preventive measures. The study seeks to enhance risk assessment and personalized care for individuals with a family history of these cancers, addressing uncertainties in genetic testing outcomes. Key researchers highlighted the necessity of understanding how genetic variants influence cancer risk, which could guide clinical decisions and targeted therapy development. Looking forward, the research team intends to apply their variant classification method to other genes, furthering our understanding of the human genome's role in cancer risk and prevention. Additionally, the study has identified critical surface areas of the RAD51C protein vital for DNA repair, suggesting new potential targets for drug development. In the UK, breast cancer is the most prevalent cancer, with around 56,800 new cases each year, while ovarian cancer accounts for approximately 7,500 new cases annually. This has been your Daily Brief in Science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.